We have to go right now and take the questions and the answers at the moment.
I want to ask whether we should not be looking at figures first and foremost as to how much these programs will be costing. So I want to find out whether we've put at least an initial figure to it even before we get there.
You are talking about the eight hospitals.
District hospitals, yes.
I think it's understood. You know that our presentation has been about the whole gamut of interventions.
Yes.
So you're talking about the 88 specific.
Hospitals.
We'll get to the answer. So figures for the 88.
Yes. The other issue relates to the case count. I realize that for some of the regions, the numbers remain the same. And I'm just asking generally because of reports of people who were tested positive, who had escaped mandate quarantine or who had been asked to isolate, who had refused. But we've not received any confirmation from the health service that those people have been found.
So you are whether they are included in the numbers as have been presented, or they are not included in the numbers?
Because if you have 10 in a region and 1 is on the run, obviously keeping a number at 10, I'm not too sure, or whether indeed...
No, but then that means your case count is 10.
Yes, and so I'm asking they have been found yet, or we are still after...
Okay, no, so let me see if I understand. Your question is that for those who are reported to have escaped, have they been found yet? Or is your question that are they included in this one?
Whether they have been.
Okay. So Ghana Health Service, have those, and what are those who've escaped? Which one are you talking about?
The northern region, and also...
Okay. This is the one Guinean lady, right?
Yes, yes.
Okay.
And also in Accra, we reported a Fadama incident. There were 2 people. One was apprehended, the other is also... the last report we put out was that the person still on the run.
Okay, so the Guinean lady and 2 from Fadama, have they been taken in? Are they part of those you have in your containment system?
Yes.
You give a provider.
And just a final one for the Works and Housing Minister. I mean, the other briefing we had, there's a bit of a support program like electricity and water. Other places, in fact, we've heard some landlords who have gone a step further to give some free means of accommodation to their tenants because of the situation we find ourselves in. I want to find out whether ministry and government, for that matter, is considering such a support program, possibly one that will be specially tailored for the Ghanaian
support program on rent.
On rent, because there are people who are saying they're not working, but their rent is due and they need some help.
Yeah, I think it's understood. Honorable Minister, are you considering a support program on rent? We'll come to you to give us an answer.
And finally, he talked about the foreigners and advising that you shouldn't rent out facilities unless you are sure that they are COVID-free. I'm asking about how about Ghanaians as well, because the statistics we have currently actually shows that community spreading is more than the imported cases that we have.
So I'll come to you to respond to that. Yes, please.
All right. Thank you very much. My name is Selo Amenya. I work with TV3. I would want to start with the health minister. He said that no project has been abandoned, but I wanted to find out about the police hospital. Since 2016, we've seen anything ongoing.
You mean
there.
Police hospital in Accra?
Yes, in Accra.
You are suggesting that since 2016?
Yes, we've not seen any works being done there.
Are you sure?
If you can update us on that.
No work on police hospital in Accra since 2016?
Yes. And also, we've been asked to wear face masks for good reason. I want to know what is the implementing plan. Are we also going to see a task force in town ensuring that everybody, because we still have people roaming in town.
So how do we plan to enforce the order on face masks?
Yes.
Thank you. May I ask that we keep the questions snapped so that we can quickly. So how will we enforce the orders on face masks? Next one.
I'm Kujajman, CTT.
Hi, Kujo, let's hear you.
3 sets of questions for the Works and Housing Minister and then 3 for the Director General of the Ghana Health Service. Works and Housing Minister, when you were giving the amount of money we've spent on flood control programs and drainage works, when you got 2016, you said 12 million was spent, right? 12 million Ghana cedis. 227. Okay. 2016, and then you said that 136 million for 2017 for the, so what accounted for that huge jump from the 2016 figure and the 2017, and also how will the ministry ensure that landlords adhere to these measures you have put in place? And my last question would be for the residents around Dansoman Beach area and then Glife, the sea defense jet exercise there has been stalled. I mean, we are in COVID-19 era. What is being done to make sure that project comes back on stream. For the health director, the Ghana Health Service Director, please, any new deaths? And then how much were the other time that we have 18,000 backlogs more? Have we been able to overcome this backlog of testing exercise? And then there are some discrepancies between the regional results that we are getting on the website. For example, the regional, the data from Bolga did not correspond with the one on the Ghana Services website.
When you say data from Bolga, help us a bit, what do you mean?
In terms of the information management data, yesterday the health director there issued a statement, and the numbers in there did not correspond with what was on the Ghana Health Service website.
So there's a discrepancy between the
regional
a statement issued by the regional health director and what is reported on the national website.
Please.
Okay, so that's a specific instance.
Yes, please.
Bolga, you say?
Yeah. Thank you very much.
Okay, Bolga and Accra difference. Please make a note of it.
But
Kwame Etio.
Africa. But my son Bisano, health minister, no. But let me be a question on if compound. Bear Busumi, you know, story war, Domain Samperman, a Wama Saman. Chief company be our man Penuku for Abbas only year 2000. Minoka say
2000.
Minoka say Empire Naji that
Pachokochi. What's the chips compound be a
man Penisino 2001 see the year 2000 no see. Minoka say Empire Naji a Danmafa. Be Busumi Nuana, Mikoya sa story no. After maybe some questions or a general hospital.
Question no. Chips compound be a no 2000. Sabri abandoned.
Okay. Empire Naji.
Ewo infa.
Domain Samperman. Amasaman.
Okay.
La General Hospital. Person we be so no can be parliamentary approval funding. Person me say funding no say no mo dey issue. Na be we da ben. After Eugene, University of Ghana Hospital. No actually be say omugusa ka phase 1 on baby. Na first kana
o phase 1 no. I'm say phase 2 no kind of.
Okay.
Because phase 1 there's so many.
I thought phase 2. Now then phase 2 no one hwe na enwi ansa abana sa e dey na kind different project be because
say phase 2 of UGMC no yenwie ya abun any sort ne can be before.
I think senka no enwi ansa na
abana can be before
different project be so.
That's it. Health Minister, please be on standby. Ghana Health Service be on Works and Housing, please be on standby. Ghana Health Service. Before I come to Health Minister, so give me a few minutes. Let me respond to the first question. So you heard us make the point that a strong economy, a resilient economy is a foundation for affording all the interventions that we've been talking about. The ones that we have done, which we have paid for, that we are paying for, the ones that we have been tasked to work on, the common denominator is a strong and a resilient economy. If you don't have it, you can't even afford all of these things. And what we are saying is that it is because of the improved nature of the economy. That's how come you've managed to afford all the things we've done so far. The same denominator is what will go for what is outstanding by the time they are done with their calibrations and giving us that figure. You recall that the president has tasked them to complete or to sync the 22 and the rest he was talking about with the broader envelope of 80 and advise the entire country. What we are saying is that the reason for which you have confidence that all of that which we started about 8 weeks ago till then is affordable is because we have a strong and a resilient economy that has improved from where we all collectively were at a particular point in time. And when they are done with these numbers, what is outstanding, they would also let us know. Minister of Works and Housing, come, let's take yours out of the way, and then we'll deal with Ghana Health Service and Health Ministry.
Let me attempt to answer the question relating to rent support, and clearly that's the voice of former President Mahama, that we should try and look into situations of giving rent support to those who are without any good place of abode. I want to refer to the 2020 budget. If you pay regard to paragraph 12, and I'd like to read, Mr. Speaker, if you add the cost of cleaning, if you add the cost of cleaning, the financial sector challenges to the long list of legacy bills that the Akufo-Addo government had to settle, the cost to the Ghanaian payer is around 33 billion Ghana. So you can see that is all financial base. The debt was 33 billion. You know, the president has had to deal with the situation because he has a very large heart and a generous heart. So free water, some people will take it for granted. There's a cost implication. Electricity, you could see we couldn't go the full hog of making electricity free because of the high cost of generating electricity. And if somebody push that people who have no place to live, as a direct result of the COVID-19 challenges, should have their rent paid, we should be able to absorb it. We have the financial space. But the first instance is that report any landlord, and for that matter, a landlady, who want to exploit these circumstances to the rent control offices, and they'll be dealt with. So I have not heard of a wholesale eviction of tenants, which will warrant that we should immediately come to their aid. If there is any situation like that, we'll get the feedback from the rent control offices and we'll handle it. But let's see if there are numbers like that. We shouldn't just wave our hands and say that we should pay for the rents of people who are suffering as a result of the COVID-19 challenges. But if we see the numbers, we'll see what we can do. But it's all as a direct result of what we can do given the financial space. So that is the first question. The second question was a bit complicated. We were trying to compare the allotment for flood control challenges and concrete lining challenge of 2016 and 2017. I think I gave the figures and I was a bit concerned what was he trying to communicate. I couldn't get the import of the question. But if you want to have the figures again, can I have the figure? I'll give it to you. So, let me take it. Yes. The figures are here. Relating to National Flood Control Program and other drainage projects for 2016, the sum of 12,271,558 Ghana was spent. If you want to know what was spent in 2017, it's in the sum of 8,136,000 and then 18.41 Ghana. And if you want to know the biggest boost in that area, is what happened in 2018, 220,584,188.69. My attention has been brought to the fact that the sea defense undertaking at Dansman is going through challenges. We have called the contractor to come over for it to resolve it. Immediately we get answers, we put it across as to what is accounting for the challenges. And I think these are the few questions that have been, yes, that have to solve, yeah.
Very well. Ghana Health Service. Yeah, so Ghana Health Service, please join us.
Thank you very much, Honourable Minister. I think I'll take the first thing, that is the number. You see, the 1,671, as you see, includes the first case that was reported on the 11th of March. So whether you are in the hospital, you have recovered, you are in isolation, and as you claim have run away, you are part of that list. You remain the same in the very thing where the case was identified. So everything we are talking about is all who have tested positive, irrespective of the outcome. In the issue of the burger, I didn't hear the burger regional director make any statement. But remember, the website is yet to be updated. There are processes of validating report. I'm sure as journalists, when you file your report, you send it to your editor, isn't it? So these processes are done to validate the report before it's published on the website. Is there a repeat test? Is it confirmed, etc.? So what you should focus yourself is about the what appears finally on the website. The Fadama case, I'm aware they've been found, and those in Tamale, they've also been found, and they are all in care. The backlog, yes, we still have some backlog. As you can see, we've done almost 6,000 in a day. And we have not stopped sample collection. But we are working towards reducing the number of days that the gap log, and there are plans to upscale our lab system, both in terms of the capacity of the individual labs and expanding new labs, creating new labs to be able to us to catch up. And that includes the backlog. I don't know whether the Minister of Health will answer the face mask, but let me ask. Let me try. I think we have used a lot of communication to explain to everybody the importance of wearing a face mask. And I believe that a significant number of people are applying. We are going to have to come up with audio and video clips that shows people exactly how to wear, how to remove, and how to maintain, and making sure that your mask covers your nose. So we are going to do all that, and I believe that the good people of Ghana will do that, follow. In countries where it's law, the enforcement is different. I'm sure if it becomes law, if it's necessary, the necessary actions will be done. But for now, it's a ministerial directive, and I'm happy that a lot of people are not only wearing it, but also making some business out of it to make sure everybody has access to that. Thank you very much. Yes. Yes, there's been 5 new reported deaths. We are in the process of validating the source, and that is why we've not mentioned them. Some were dead on arrival among others, so we are validating. As soon as we do that, it will appear on the website, and everybody will know exactly where they have also come from. Thank you very much.
That's Dr. Patrick Aboagye there answering some questions there. Before him was the Minister for Housing. But Dr. Patrick Aboagye makes some very startling revelation about 5 new reported deaths. He said that it was not mentioned previously because they're still validating the figures. They're validating the figures to make sure that they can give us where it is coming from, where those numbers are coming from. But essentially what he's saying is that there have been 5 reported deaths. They just want to be sure that it's related to this. Let's go back to the Health Minister.
In Accra. I've been explaining and talking, and it's like nobody is hearing me. We have about 5 different health service providers in this country. 2 big categories of public and private. So we have private sector people, those who have established their own hospitals. They are private. They have an association, and we work with them as one health service provider. We have what we call quasi-government institutions. So government organizations like Cocoa Board, Ports and Harbors, Bank of Ghana, the military are different, the security group. So the SNET, These are government institutions, but they own their own hospitals. Oversight is by their boards. It is a department in the organization. So their board and their management take charge of them. They employ their own doctors, they build their own facilities, they hire their own professionals into the service. So they provide service for their workers and their fleets, and in some instances for the public. So that's the quasi-government institutions. Then we have the securities hospitals, the police hospital, the military, the prisons even. All the security agencies have their own hospitals for some obvious reasons. Then we have the public ones, that is the Ghana Health Service, that provides close to about 70% of healthcare service in our country. Then we have Christian health associations. Now, because the Islamic faith also established in hospitals, we in the ministry put them together as faith-based hospitals. The Islamic ones and the other Muslims, they are building hospitals together with the Christians. Now, the Minister for Health oversights, then the teaching hospitals, I didn't mention that one, but that teaching hospitals are not part of Ghana Health Service. So the Minister oversights the teaching hospitals and Ghana Health Service to the extent of their construction of their facilities, their implement, everything. But we play a complementary role with the Christian facilities, and in some instances even the security and the quasi institutions. If they need some technical advice from us, write to us and we go and assist them. So if you ask me about the police hospital in Accra, that question should have gone to the Minister for Interior. You see, when I was talking about infrastructure, I was talking about the problems and things that we have with some of our contractors. So as I stand here, I may need to go and do some checks. Other than that, I will not be able to tell you the actual reasons why the hospital, the police hospital has stalled. Like General Hospital, we expect to complete the project in 24 months, and the cost is about 63 million euro. It includes the cost of demolishing and bringing it up with equipment to make it fit for purpose. I think this is about 2 questions that came up, and thank you very much.
Minister, thank you. Let me call on Zoom Lion Ghana Limited that is here. I do understand a check. Please step forward very quickly so that we can receive that one. And then Maglin Industries, that has also got products here. Zoom Lion. Honorable Deputy Minister for Works and Housing, you want to help me with this? Yes, sir. Please take it for us. A check for 100,000 Ghana cedis, I understand. 100,000 Ghana cedis from Zoom Lion Ghana Limited. We are grateful for your contribution. Thank you so much. And then Maglin Industries. Maglin Industries. Maglin Industries. Where are you? Please come here. Honorable Deputy Minister. Maglin Industries. You have products. So please put your products right here for us. Sanitizers and a few other products which will be made available to frontline.
Some donations coming in there that's meant to be made available for frontline workers as well. I'll just go over the numbers that Dr. Patrick Abuaji gave, Director General of the Ghana Health Service, and then we'll go back there to wrap up that press conference. 1,671. That's the latest case count of coronavirus here in Ghana. 10 of them in Tamale. 1,113 gotten through enhanced tracing. 1,461 are well. They're responding, we understand, to treatment. 6 are in between moderate and critical conditions. 2 of those people are the UGMC Kolebu Teaching Hospital has 1, Ga East has 1. 188 people, by the way, have recovered. So that's the good news there, right there for you. 237 people, we understand, are in isolation, self-isolation, taking care of themselves. 174 of those are between Accra and Central Region, although all of them came from the Greater Accra region. 50 of those people, I'm talking about the figure in isolation, 237, and the breakdown is that 174 in Accra and Central Region, but all of them are from Accra. 50 are in the Eastern Region, 9 are in Kumasi, 5 are in Tamale. Let me give you a regional breakdown according to Dr. Patrick Aboagye of the figures that we have. The Upper West has 8. Upper West has 8, Upper East has 18, Northern Region has 13, OT Region has 17. 13 of them were people who were just passing through the region. Volta Region has 11 as of now. Eastern Region has 57, and then the Ashanti Region has 84. The Central Region has 18, Western Region has 1, the Northwestern Region has 1. There are some other regions, by the way, that have not recorded any of these cases. That's the Bono Region, the Bono East and the Bono West Region, and the Savannah Region. So far, these are about the 4 regions that have not recorded any cases, but all the other regions have recorded cases, starting from the Western Region, which has the minimum, the Western and the Northwest Region, which have the minimum, that's 1 each. Central Region has 18, Ashanti 84, Eastern 57, Volta 11, OT 17, Northern 13, Upper East 18, Upper West 8 so far. And this is what we have at the moment. And well, we're told that the briefing has just ended. They came to give us an update on the figures so far, so you know what the latest figure is, and also to give us the assurances, if you like, that the existing infrastructure, health infrastructure projects will not be abandoned, even as government look to bringing up the 88 new district hospitals that President Akufo-Addo indicated in his last address to the nation. We'll update the figures as well on our screen. We'll update them. We already have updated them, so there you have it on your screen, the figures as it shows. There'll be more of that story in our subsequent bulletins and at myjoyonline.com. Sincere apologies that we're unable to bring you our top stories as we brought you, but we'll have those stories in Joy News Prime, also at myjoyonline.com. My name is Gifty Ando Apia.